What do you do when you need help or information from a professional? If you use an internet search engine, you have to discern the best search words and then the author of the results. Is the author really a trained professional on the topic? Don't you wish you knew someone you could talk with to get professional guidance? What if you could go to one site to connect with relatable and easy to understand professionals to address your needs? Wouldn't that be your go-to site for professional support? Voila, Accessible Professionals, connecting you with professional support from professional voices. We have selected 3 sectors our members need the most help from: health, education, and legal. Our care navigator will identify which professionals address the concerns you have and will follow up to ensure that suitable solutions and connections were achieved. Members can connect with their favorite professionals through one-on-one consultations, blogs, or virtual workshops. The professionals also benefit from the care navigator connecting them with someone who needs the knowledge that they have. Because isn't knowing half the battle? Accessible Professionals, helping you spend less time searching for answers and more time on what matters most to you. Hello, hello, hello. Welcome to the Reproductive and Fertility Live Q&A. I am Dr. Kia Lannaman. I am the co-founder of Accessible Professionals. We will be having a featured guest, Dr. Erica Louden. She will be joining momentarily. Dr. Louden is running a little bit late. She's giving families babies in the office and in surgery, and so she'll be jumping on as soon as she is out of surgeries. I think she had an embryo transfer. Exciting stuff, helping families and couples conceive. So I'd like to kick off and establish who we are, what we're doing, what this live is going to be about today. So first, we are going to be talking about reproductive health, and we want to be as exclusive as possible in the language that we use, and we definitely want anybody that is interested or has questions or has had challenges with fertility and infertility and reproduction to know that this talk is for you. And so give us grace if we are not as inclusive as we intend to be with some of the language that we use, but we mean to include everyone. So I am an obstetrician gynecologist. Dr. Louden also is an obstetrician gynecologist, and then we both have done extra training in different areas. I went into maternal fetal medicine, which is a subspecialty or kind of a focus within obstetrics and gynecology, and she went into reproductive endocrinology, which is the common term is kind of like fertility medicine or reproduction. So really, this Q&A is in her niche and an area of expertise. And we have requested questions from our members and from those who are watching our channels. And we really just want to get answers to you about the world of fertility and reproduction. And so I'm going to start off the Q&A because we have a lot of questions to get through. And then the real expert on the matter, Erica Louden, will join once she's out of surgery and into our virtual studio. So in general, about our brand and our business, Accessible Professionals, we are here to make connections between the regular people who are seeking information, who are seeking professional services, and those professionals that have that information, who have those services to offer. And one of the things that we really want to do with these lives is to introduce you to different areas of different professional sectors. Our first phase is starting with the health sector, primarily because I work in the health sector and I feel somewhat familiar and a part of that world. We're also going to be doing the legal and the education sector over time. And we want to just introduce you to different people that do different things, to different concepts, to demystify this whole arena so that you know who does what, right? Because if you don't know who can help you, you don't know who to turn to get answers to the questions you have, for consultations that are going to address the issues that are going on in your life. And we're here to make that easier for you. We have individually as the founders walk the hard road of not knowing where to start when we needed professional help, and we want to make that easier for everyone else. So we will be joining with Dr. Louden shortly once she comes on, but I'm going to start us off with some of the questions we've received because we have a good amount of questions. All right. And we'll listen up for Dr. Louden to hop on. Okay. So the first question I have is, For those who have geriatric pregnancies, what are the best tips for new moms during pregnancy and post-delivery? I'm going to skip to the questions that I think I can answer and then leave like the really hard ones for Dr. Louden when she joins. All right, so what is a geriatric pregnancy? I mean, that's a horrible term, right? So in general, some people call that if you are 35 years or older at the time of your pregnancy, not that you're really geriatric, but essentially they're saying that you are of advanced maternal age, and unfortunately 35 and older is advanced. So I would recommend anybody that's 35 and older, there are different things that could be recommended to a pregnant person that's over the age of 35. And so I think one of the best things to potentially do is get a consultation with somebody in my specialty, which is maternal fetal medicine. And then just get some guidance on whether there are things to do to optimize your pregnancy outcomes. And the best time to get that consultation, I would say, is in the first trimester, because there's some things that they may want to implement early on. All right. And then, you don't necessarily have to be a high risk pregnancy just because you're 35 or older. You might be able to just get a consultation one time, get some guidance, and then, have a fairly normal remainder of your pregnancy. And it doesn't mean that if you get a consult once with a maternal fetal provider that you have to see them for your whole pregnancy. We often work with midwives and general OBGYNs and just do consultations on a particular thing, but those other providers are caring for that pregnant person. Another question I think I can answer, I think this is kind of like a piggyback off of the live that we did several weeks back with Doula Ariel. And that question is, how important is a doula? So we talked about a doula at that live. We got to meet someone who provides those services, and she spoke in her own words about what she offers birthing persons. And one of the takeaways is that they're awesome. Doulas are an awesome support person. So the question is, how important is a doula? I would say I'm realizing they're more important than I had previously given them credit. What are some options if you cannot afford them? Well, Ariel, talk with us about different things when it comes to paying for doula services. So I would say, to remind you of some of what we talked about in that live, is be upfront about your finances with a doula, and see if you can come to a compromise on payment that is mutually beneficial for everybody. Some tips are, you can see if you can use your health insurance dollars to pay for things, especially like a health savings account dollars. Those funds are often really discretionary. And this is this person that's like part of the health support team, right? And then one of the tips that Ariel gave also was, consider putting it on your registry and let your loved ones chip in to the cost. There are also different tiers of support that a doula provides, which is what we learned about. There's the prenatal support, the during the birth process support, and then there's a postpartum. So, maybe you can afford the prenatal and the intrapartum, but maybe you're not going to get the postpartum support. So talk it over. Just be honest about your finances, and you might be surprised that doula may have financing options or pay as you go, or maybe like there's like donation charity money that they know about that could help you, because their hearts are big. They really just want to be of service. And so I would say investigate it more before giving up on the option if your finances are tight. All right. Is there any way to learn if you're prone to miscarriages? Is it genetic? And definitely, hi, Dr. Louden.
Hi, how are you? I'm sorry I am late.
She's late because she's a boss and she was putting babies in mothers' wombs who were trying to conceive.
We're making some babies. I don't know if you can see that little bitty sign in the corner. We're making some babies today.
On their own schedule. They do not play around for lives, so that is okay. So this is Dr. Louden, our featured guest. Dr. Louden and I have worked in the same place at the same time at least once. Mm-hmm. We were in Detroit together, #Detroit, doing slightly different things, but more or less in the same department. And then actually, I'm now in the region where she was before. I'm in St. Louis, and she's been in St. Louis. And we're both mochas, so awesome. #Black History Month. Black History Month.
Black magic.
All right. So, Dr. Louden, do you want to say anything more about yourself? I have introduced you that you are the expert here. I was just kind of going over some things that I thought I could answer, but that really we're here for you to tell us about your niche, which is fertility and reproduction.
I can share, yes, I'll share some more about myself. I'm from Chicago. I'm practicing in Chicago, Illinois. However, I see patients all throughout the United States and overseas because the one beauty of COVID is telemedicine is here. And I don't think it's going anywhere anytime soon. So we can take care of patients everywhere. And we just collaborate with colleagues to help with monitoring blood work and things of that nature. I take care of everyone. So same-sex couples, single patients who, don't have partners. And I think there was a question about that. We'll explore that deeper. My passion though is oncofertility, which is a field of medicine where patients who have cancer diagnosis or even are on medications that are considered to be toxic to the ovaries and can make them sterile, meaning infertile in the future. We help and assist with them before they have to go through their life-saving treatments or their medications that can cause that. And we help them freeze eggs, embryos, and things of that nature before that happens.
Side note, Dr. Louden is being very humble. She's a brilliant person who has multiple degrees, more than me, and she actually has a PhD.
Oh, yeah, I was crazy in those days.
As well as an MD. She's a double doctor. So I'm going to try to be the person that makes sure that we speak at a level that everybody can understand in case Dr. Louden is so up there. I'm going to be the ambassador for the regular people who need it simple.
I'm a regular person. I'm speaking on regular terms today. So if I don't say anything correct, Dr. Lannaman will keep me on. She'll keep me in check.
So tell us a little bit more about who is like the ideal person to come and get an assessment. We're doing a giveaway. Part of the live, there's a fertility wellness checkup that Dr. Louden has gifted us, and one lucky winner, if you go to www.apcares.ca, A for accessible professionals, P for professionals, we care. Anyways, you can enter the contest to have a wellness checkup. It's valued at $99, and it includes things that relate to the womb, the semen, and ultrasound. So who benefits from getting an evaluation from a fertility specialist like yourself?
So that's a very broad statement. So there are lots of categories that would make you someone who would be eligible or think that you need to see someone to check out your reproductive health. So I'll start with the single ladies like myself. So you are single and you are a career woman and you're delayed, think you're going to delay your time to pregnancy. You might just want to see where you are because as women, we are born with all the eggs we're ever going to have. And so, I used to hear that joke about this, a biological clock ticking, where there is a real clock. And so if you're someone in that category where you're not ready to have children yet, but you do desire them in the future, then that's one reason to see us so that we can check your reproductive health and see what your ovarian health status is. And it's a possibility for you to freeze those eggs for future use if you desire. So, and men, I hate to leave out the boys. Boys, you can freeze sperm too, and it's a lot easier for you. Also, once again, that single category, if you are single, but you do want to have a child yet, and that Mr. Wonderful or Mr. Right hasn't shown up yet, well, you can come see a reproductive endocrinologist, and we will take you through that journey of, getting those eggs out, selecting donor sperm, or if you have somebody who's a good friend who wants to be your baby daddy, then we can do that and help you create embryos and get pregnant. Either it can be in vitro fertilization, and I'll explain what that is, or we can do insemination. That's one baby at a time versus IVF. We create your whole potential family at once. Then we come to the married couple that you have been trying to conceive and you have not been successful. And that's a difference. And we based it off your age. If you are 35 or younger, if you've been trying for a year or 12 months, then that is the definition of infertility for us. And that is time for you to seek evaluation so we can see if there's something we can do to help speed up that process. And if not, what are some treatments to get you there faster? Then that same thing, I talk about couples. Well, we're in this world where, it's okay to love whoever you love. And so, but we always need sperm and egg. And so if you're in a relationship where you don't have both of those things, then once again, it's time to see a REI who can help you with that. There's also couples who may have something where they know they had a hysterectomy or they have fibroids and they can't carry a pregnancy. And you're going to need a surrogate, a carrier to carry your pregnancy for you. That's another reason to see someone such as myself. The list is so long. Do you want me to keep going through them? Because
I
there's
think
some
I think this is great because I think a lot of people don't know about the field. I know that you do a lot of lives, and so the people that commonly come onto your page are getting educated on a regular basis. But our community, it may not really know some of these things, and this is a really hot topic. I think there's so many people that are career driven that are putting off growing a family until mid 30s, early 40s, when they finally feel like their life is more balanced, and then maybe some of the conditions that they've acquired over that time, they're concerned about the impact. So if you feel like there's another few common reasons that people come to see you that you'd like to go over, I think this is great so far.
Okay. Yeah, some very common reason where people come to see us is, you have polycystic ovary syndrome. And for those who don't know what that is, that's when a woman doesn't ovulate, have irregular periods. And so they are not releasing their eggs and you want to have a baby. Well, it can be very simple to help women in that situation. If you have endometriosis, it can be difficult to get pregnant on your own, or we know that it does impact the health of your eggs over time. So even if you're, once again, not ready to get pregnant, but you have endometriosis, that's a good time to see a provider. So we kind of break it down to like uterine factors. If there's something with the uterus, fibroids, endometriosis. If you know you have scarred fallopian tubes, or you're concerned that, things happen in the past. If you had infections there, you're worried about your tubes being open or being damaged from that, then that's something there. We call it tubal factor. If there's cervical things, or even if it's because we always tend to focus on women. I don't want to do that today. It takes two. So boys, if there's a sperm in there, a third of couples, there is male factor infertility. So if there's any concerns with that, or once again, it's just that you have medication treatment, like you've been exposed to radiation, chemo, those are reasons that you might want to get your reproductive organs and your health checked so that we can assist you get to your pregnancy, because age is the single most prognostic important factor with this. And that's something we really are trying to get out there. Yes, we can help you have babies at older ages, but it is much more difficult. And even if it's where we test and we see that your egg health or quality is diminished, we do have donor eggs, we have donor embryos. So there are so many ways to become a parent, and we want people to be open to those different areas, and we help you explore that.
Awesome. All right, so let's get into some of the questions that we have. And so maybe I'll ask you ones that I skipped. So you talked about fibroids and endometriosis. And there's a question that we got about fibroids. Can fibroid location determine issues with pregnancy? And so I'd like to kind of rephrase it. Can fibroid location affect fertility?
Okay. Yes, fibroid locations can affect fertility. So when we're doing evaluation, we always check the uterine cavity. So there are multiple types of fibroids, and when we say that, it depends on where they are. It could be on the outside layer of the uterus that kind of protects, and we call those subserosal. It could be in the muscle wall, and it can be inside the uterine cavity. The ones we really concerned that can cause mechanical issues for fertility, meaning it's in the space and taking a space and blood supply from an embryo that would like to grow and thrive. Your embryo has to go there. So if there's a fibroid inside the uterine cavity, it can increase your rates of miscarriage, is what that means. Or we do have, and I tell couples all the time, you may be getting egg and sperm meeting, and when they fertilize and it's rolled into your embryo implant. Well, where is it going to go if you have a big 2-3 centimeter fibroid? And so when we see them in the uterine cavity, specifically, we always say to remove it to optimize the chance that you get pregnant and you stay pregnant. The other fibroids, they are too concerning, but less concerning. Like they're not causing infertility, but they can cause problems with you staying pregnant. It's kind of the take home point with that. Those other fibroids, the bigger they are, the more concerning, because your uterus has to get bigger and it's going to grow with your pregnancy. You will be very uncomfortable. So depending on the size and the location kind of dictates whether we say we remove them beforehand, or you can kind of leave them and watch them.
Great. So I'm going to piggyback off of this. So just to kind of say it again, what Dr. Louden said, if you consider the womb like a fruit, like a peach or something, the inside core where the seed would be is the inner part. Those fibroids in that location, the inner core, are the ones that can create issues with getting pregnant. And then in like the kind of fruity part is that muscle thickness area. Those might aggravate your pregnancy, but they may not cause you to not hold a pregnancy in. And then the ones that are on the skin may aggravate you and create issues with constipation or abdominal pain, but they may not create issues with you getting pregnant. And depending on how large those are, they could be problems during your pregnancy. But I want to say, as a high-risk obstetrician, we have a lot of moms, a lot of pregnant persons that have fibroids that can have very safe pregnancies that may not be bothered at all. And some people will recommend interventions for different types of fibroids. And so it's important. What Dr. Louden is suggesting is that if you're trying to get pregnant, especially if you've had some difficulty getting pregnant, then maybe addressing the ones that are on the inside of the womb are worth doing, but you don't necessarily need to address the ones on the outside or in the bulk of the womb to get pregnant. And sometimes those have like really significant effects on your pregnancy, depending on the type of surgery that was done. So I would say if you're considering having surgery for fibroids, maybe have a consultation up front with a fertility specialist to know for sure whether or not you need to do that kind of thing, or like which ones to even, to worry about. All right, PCOS. So we talked about PCOS, we named it. Is there a definitive test to diagnose PCOS?
So there is a different, well, we call it the Rotterdam criteria, because it's a syndrome. It's not a disease. There's a constellation of things that go along with it. And so it's having cystic appearing ovary. So we look to see how many little ovary or follicles with eggs are trapped at the surface. And if you have a certain number, that's one criteria, but you have to have two. The second one is if you have missing or irregular periods, you skip periods. So if you're skipping periods, not having periods regularly, that's another sign. If you have those two, that can make you PCOS. The third thing is that you may have not have any of those, but one of them. And so the other criteria is you have high levels of male hormone testosterone. And so we look for clinical signs, that can be like excessive hair on your upper lip, your chin, your chest, your inner thigh, in the male pattern area that's thick and coarse. But we will draw your blood too, because sometimes you may not have that, but if we draw your blood and we see that your testosterone is higher than what's normal for a woman, that is another sign. So we need 2 out of 3: irregular periods or missing periods, PCOS appearing, or cystic ovaries, or elevated and testosterone. We also have to exclude other things that can also mimic PCOS. And so for us, we always draw 17-OHP, which is just an enzyme. I'm not going to belabor it, but it's something that can it's called congenital adrenal hyperplasia, and you can actually get it as you're older. And so that can mimic PCOS because you have high testosterone. So we rule out other things that can mimic it. But if you have 2 out of the 3 of those things, you have a diagnosis of PCOS. However, let me put the caveat. We don't diagnose you when you're a teenager with PCOS, because is it normal for you to have irregular periods when you're a teen? Yes, you're just starting your menstrual cycle. So things are your body's trying to figure out what's going on. The second thing, well, you are just starting your reproductive. You're going to have lots of eggs. So it's common for you to have cystic appearing ovaries. So when you're a teen, we don't diagnose it. But once you are like in your 20s, if you're having these symptoms or anything, then we start looking for that as a cause.
Oh, thank you so much for clarifying that. I think sometimes we definitely have overdiagnosis of things in younger persons, rather than kind of reassessing whether something that looks a little bit out of the ordinary really is a problem later on. So thank you for addressing that. I mean, we used to do that with pap smears, and now we have an age where we recommend starting pap smears and not really even doing it, beforehand, unless there's a strong reason to do that.
Absolutely.
Okay, another great question. Oh, I have an echo. Do genetics matter? For instance, my grandmother had both kids. Will I be successful, hypothetically, if I'm already 40 at getting pregnant?
Unfortunately, fertility is not genetics, as far as because your grandmother had 20 kids, 15 kids. That doesn't mean it's the same for you, unfortunately. Can we get that common question out? Because a lot of us, the thing that we're trying to dispel that myth, especially in minority communities, is because we were fine. My auntie had a baby at 47, so I'm gonna be okay. I don't have to worry about it. No, that's not necessarily the case. Yes, those things can occur. People older, especially in times past, even though we weren't necessarily going to the doctors as most commonly, but there's a lot of more environmental things that we face that they did not face that can affect our fertility. So long story short, no, genetics is not involved when you're thinking about fertility. It is in another aspect, but I don't want to milky or muddy up the picture. When we talk about infertility, there's some things that can be genetic based, but when you're talking about I'm going to be successful in having children, it's not any fertility or genetic links to that.
And let me also add on to that, which might be hopefully it doesn't make it more complicated. There are a small number of conditions that are related to genetics that could cause someone to have infertility, and then there are some random genetic changes that happen sometimes when an embryo is forming that are often involved in early miscarriages. So genetics are involved in multiple different things, but I think the question that the person submitted is what Dr. Louden answered, in that you can't bank. It's more individual factors for fertility than banking on your ancestors or your relatives' histories.
Correct. That's true.
So I have a question that was sent to me. Okay. I say I'm 40 years old already, and I have multiple sclerosis. I already have a child, and I have some frozen embryos. But I'm not sure what to do with the frozen embryos. I'm not sure whether I want to be pregnant. I'm wondering, what are my chances of having a successful take of implanting those embryos and getting a pregnancy at the age of 40? Should I do surrogacy? And it's a really compound question.
It is a compound question. So first thing, the age in which you did your embryo creation is the age of those embryos. So it doesn't matter if you're 40 right now, if you created those embryos at 35, because 35-year-old embryos are healthier than they are at the age of 40. So that would be the first question. When did you freeze them? If you froze them when you were in your early 30s, mid 30s, they're fine. Second statement is your uterus is a muscle. We have people getting pregnant 50 with donor embryos and even their own embryos that they created years prior, because your uterus, all it needs to do is respond to estrogen and progesterone, the two major hormones that allow for implantation. And if it grows thick and fluffy, it can carry a pregnancy. The caveat is there anything else going on with your uterus? So it's not the embryo. The age of the embryo is perfect if it was created younger than 40. The thing is there anything with the uterus? Do you have fibroids? Do you have endometriosis or adenomyosis? Not the money. If you've heard those terms before. Do you have scar tissue in the uterus? Those are things. And then what medicine have you been on with your multiple sclerosis? Because there are some medicines that can make your uterus less likely to respond to hormones and grow thick enough. But we have so many great off-label uses of things like, I'm gonna throw this one out here and people are gonna be like, what? We use Viagra for uterus to help them. We use plasma-rich protein from you. We draw your platelets, centrifuge to get the plasma. We can do infusion, and there's growth factors, and the studies show that it helps with your uterine lining. So I won't discourage you. I'll just say it's individualized. Once again, talk to your doctor. I'm not worried about your embryos if they're not 40-year-old embryos, because even those can be tested too to make sure they're genetically normal before we transfer. Because the most common thing we see when women are older, 40, 42, you can't get pregnant. We just have higher rates of abnormal embryos, which is why you miscarriage or don't get pregnant. So test them before you put them in, reduces miscarriage.
Awesome. All right. We're going to address a technical difficulty going on because this is a great discussion. We still have lots of questions to get through. And unfortunately, Instagram is not working well. And we have been entertaining Facebook, LinkedIn, YouTube, Twitter, and they've all benefited from this. So for our Instagram persons, because Dr. Louden is huge on Instagram and we can't do our community wrong, we are going to transition this party to Instagram. So, Dr. Louden, if you have your phone and you want to go live on Instagram, I can go live on my Instagram. Oh, wait, I need my partner to tell us how to do this. Partner, why don't we're going to go on our phones, and I'm going to look out for me to call you or to invite you. That's what I need to do. I need to invite you to a live on my phone.
Got it.
Feel free to keep addressing your question while I set up reaching out to you on my phone.
So I can keep talking about that. As far as the last question was about whether, these 40, you're 40, you have embryos, you don't know if you want to be pregnant is the other question. Well, if you don't want to be pregnant, what can you do with those embryos? There are people, you could donate your embryos to a couple that's in need if you think you don't want any more children. There's one organization that I really like called Snowflake that accept donated embryos. You can discard them, which some people have a hard time with, but you can discard them. You can donate them to science, and no worries. Guess what? It is illegal to clone anybody in the United States. We do not clone anyone. When we say donate to science, what happens is your embryos, your precious embryos, we look at like different things like elements that they need to grow, like carbon dioxide, oxygen, nitrogen. We test different levels and see how your donated embryos, do they survive? Do they grow and thrive when we say, donate to science? And then my favorite one, if I had embryos, I have eggs on ice. I don't have embryos. But if I had embryos on ice and I was looking what I will be doing in the future if I ever use these things is that I will do something called compassionate transfer. And compassionate transfer is you've had one or two babies, you still have some more embryos available. Well, we will take those embryos and we put and transfer them directly into your uterine cavity, at a time where you can never get pregnant, which is usually right after your period. We would transfer them and let your body just take care of them and go back to Mother Nature at whatever your beliefs are. And so your body just resorbs, like every month when you release an egg and you don't get pregnant, your body takes care of it. It's not a miscarriage because it did not implant into your uterus. So those are your options. You could donate, you can give them to science, you could discard, or you could do something called compassionate transfer where you just bring those babies home, but not to have it. So I hope that answers your questions. And if you have any more, let me know. I'm here to help. Why don't we? And so back onto like other ways that we help patients, because I think I didn't finish that. Other people who may find it beneficial to seek services or care with REI.
Are you getting an invite from me? I can't tell.
I am. I'm joining now.
Okay, good.
I was trying to talk and do that at the same time.
Your name was like, I couldn't tell if your name was really coming up.
Okay. It says I requested, but you haven't accepted me.
Oh, Instagram is always so much fun.
It is. Love it.
God
but
bless.
It's okay. Other groups of people who see me commonly is outside of, like we talked about, uterine factors that may cause you to see me is same-sex couples. They're also in the community where people are. I think we're on. So I'm transitioning.
Are we on? Okay, I can't tell. I don't.
No, it's not showing. Okay.
Oh, it says we're live. Okay. My partner says, I think it's working. I'm just gonna put my phone on the side.
Okay.
All right. So, and then now I can't see my questions. It's okay, but you have the list of them, so hopefully it's working.
Okay. Now I'll pull up the list of questions that I have. If I can find them too. I think I heard some questions. Like one that I remember was about if you have fibroid or endometriosis, are there any special diets or anything to assist with that? The data out there is conflicting. I'm going to just say there's some studies show that there are some things you can do, like doing a vegan or keto diets to help with it. The whole thing that I tell specifically about endometriosis is an inflammatory disease. And that's because there's blood outside of the uterine cavity where places it was never meant to be. So what happens is, in that case, that inflammation can cause DNA damage to your sperm. Your eggs, damage to ovary and things of that nature. So I tell patients to do an anti-inflammatory diet, meaning I put my patients on coenzyme Q10. That's a supplement you can find in GNC, Walmart, Walgreens, anywhere that there's a pharmacy at. And so when we do that, those things like coenzyme Q10 is an antioxidant that reduces the free radicals, those molecules that float in our circulation that damages the DNA. The other thing is I put my patients on, I want you to eliminate as much processed foods. Does that mean that you can never have like eat out at the restaurant? No, of course not, because that would be very boring. So do enjoy those things, but I want you to reduce like processed foods in your diet. You're eating at home. I like green smoothies. So smoothies with like blueberry, raspberries, those are very high in natural antioxidants, anti-inflammatory things like turmeric and ginger you can add to it. Those will help your body naturally reduce the inflammation and things in the body. I am also a believer of alkaline water. I don't know if anybody follows Dr. Sabay. He was a believer in alkalize and said changing the pH of it. Those things do have an effect. So yes, long story short, there is no real good studies that say that this works, but we know that everything in moderation is benefit. I never put my patients on, like, I don't want you to go on a diet and starving yourself, because you actually need healthy fats for your eggs and your ovarian health. When people are underweight, we see negative problems, outcomes. When people are obese, we have it. So it is really about moderation. And so on that whole fat thing, cholesterols that we eat in our diet. So I don't want you going to McDonald's and getting your fats. I want you doing fish. So it's kind of like a Mediterranean diet. So fish, when people don't eat fish, I tell them do omega-3 fatty acids. You'll find a lot of REI say that, because people don't realize the cholesterols that you eat in your diet are actually the building blocks for your hormones. So cholesterol comes in, it converts to progesterone, which is one of the main hormones that helps with pregnancy, but that hormone is the precursor. It makes your testosterone and your estrogen. So you cannot eliminate fats, and you don't want to have crappy fats in your diet. So, and olive oil is high in certain types of omega fatty acids, and you want those things. So yes, you do want to be conscious of your diet, but you don't want to be restrictive where you're eliminating one food group. You want to make healthier choices.
Awesome. All right, I'm not sure. I think the best thing to do, because we're definitely having issues with the Instagram community, is I think we should transition and end this live that is being broadcasted and start a new live that Dr. Louden starts from her channel and invites me to, and we keep going through some of these questions for our party, because I think unfortunately Instagram we're having a difficulty keeping it on the stream that has already gone out to Facebook, Twitter, YouTube. So all of those other channels have benefited from this live Q&A, and the Instagram community unfortunately has been left out. So we're going to take a pause. Dr. Louden, if you want to drink some water, and then we will do our after party, finish going through some of these questions so that your community gets to see your lovely face and hear what we're doing.
Hear from you, because I send them all to you next. All right.
Out to me on the Accessible Professionals, so that our Accessible Professionals community can join you on the live.
All right.
All right. Come over to Instagram for the after party.
For the after party. Let's do it. Bye.
What do you do when you need help or information from a professional? If you use an internet search engine, you have to discern the best search words and then the author of the results. Is the author really a trained professional on the topic? Don't you wish you knew someone you could talk with to get professional guidance? What if you could go to one site to connect with relatable and easy to understand professionals to address your needs? Wouldn't that be your go-to site for professional support? Voila, Accessible Professionals, connecting you with professional support from professional voices. We have selected 3 sectors our members need the most help from: health, education, and legal. Our Care Navigator will identify which professionals address the concerns you have and will follow up to ensure that suitable solutions and connections were achieved. Members can connect with their favorite professionals through one-on-one consultations, blogs, or virtual workshops. The professionals also benefit from the care navigator connecting them with someone who needs the knowledge that they have. Because isn't knowing half the battle? Accessible professionals, helping you spend less time searching for answers and more time on what matters most to you.